The emergency room erupted into chaos after a bus crash. Patient after patient rushed through the doors. A small woman with long brown hair quietly pulled on her gloves. A doctor whispered to his colleague, "For the next 3 hours, she'll just be running paperwork." 3 hours later, the head surgeon stood frozen. His face went white as he watched her handle a complex wound that he thought only doctors could manage. He could only say one thing: "Who trained you like this?" Meet Laura Keating, 32 years old, Irish-American heritage, long brown hair that she always kept perfectly tied back, calm eyes that seemed to see everything. She had just started her new job as an ER nurse at St. Alder's Hospital. On her first day, Laura arrived early. She quietly checked the medicine cabinet and medical supplies. Nobody paid attention to her methodical routine. A young doctor smirked and said, "Why are you being so careful? This is the ER. If we run out of something, we'll just call for more." Laura simply smiled. She didn't argue back. During her first shift, something caught her attention. A patient had unusual bruising patterns that others had missed. She quietly reported it to the attending physician. This simple observation saved the man from internal bleeding that could have been fatal hours later. Nobody mentioned her quick thinking, but the patient's family secretly left a box of cookies and a note that read, "Thank you for noticing." Her colleagues thought she was too slow, too quiet for a chaotic emergency room environment. The charge nurse pulled her aside and said, "Maybe you should work in the back office. You don't seem suited for frontline patient care." Laura nodded politely, but something flickered in those calm eyes. Week after week, the same pattern continued. While other nurses rushed around making noise, Laura moved like a ghost through the emergency room. She would quietly adjust a patient's IV drip, reposition someone who was having trouble breathing, check vital signs that others had missed. The results spoke for themselves, but nobody was listening. A senior doctor complained during a staff meeting, "The new nurse is too hesitant. In emergency medicine, we need people who can think fast and act faster." What he didn't see were the small miracles happening in Laura's wake. The elderly woman whose heart medication was adjusted just in time. The teenager whose concussion symptoms were caught before they became serious. The construction worker whose infected wound was properly cleaned, preventing sepsis. Laura kept a small notebook where she tracked every patient interaction, not for credit or recognition, but to learn from each case, to become better at reading the silent signs of medical distress. Her locker was sparse, just a change of clothes and a water bottle. But there was one personal item that nobody knew about. In the pocket of her scrubs, Laura always carried a silver pen engraved with the letters DP. In medical terminology, this symbol represents pressure, differential, the silent indicator of hidden danger that most people cannot detect. This pen was her reminder. In medicine, the most dangerous threats are often the quietest ones. During lunch breaks, Laura would sit alone in the hospital cafeteria. She would review medical journals on her phone while eating a simple sandwich. Other nurses gossiped about their weekend plans or complained about difficult patients. Laura studied trauma protocols and emergency procedures. One afternoon, a paramedic brought in a car accident victim. The patient was conscious and talking, so everyone assumed he was stable. Laura took one look at his skin color and pupil response. Something wasn't right. She approached the attending physician quietly. "Doctor, I think we should run a CT scan immediately." He brushed her off. "The patient is alert and responsive. We have more urgent cases." Laura didn't push back. She never did. 2 hours later, the patient collapsed from internal bleeding. He survived, but barely. Nobody connected Laura's earlier warning to the near miss. They were all too busy to notice the quiet nurse who seemed to see danger before it announced itself. But Laura noticed everything, and she was getting ready to show them exactly what 3 hours of chaos could reveal about someone they had completely underestimated. In Laura's scrub pocket, alongside that engraved pen, she carried something else, a thin silver bracelet with coordinates etched into its surface: 36, 3,398 degree N, 43, 1,189 degree E, the exact location of Mosul, Iraq, a place that had taught her everything about staying calm when lives hung in the balance. It was a Tuesday evening when everything changed. The radio crackled with an emergency alert that made every staff member freeze. Multiple vehicle collision on Highway 45. Bus versus semi-truck, 14 casualties incoming. ETA 7 minutes. The emergency room transformed instantly. Dr. Whitmore, the head of surgery, took command like a general preparing for battle. His voice cut through the chaos. All hands on deck. Trauma Bay 1 through 6 are now active. Senior nurses take the critical patients. Residents handle walking wounded. Then his eyes found Laura. New nurse takes Station 4. Paperwork and basic triage only. Do not make any medical decisions without direct supervision. Laura nodded without expression. She had learned not to argue with authority figures who had already made up their minds about her capabilities. The first ambulance screeched to a halt outside. Paramedics rushed in with a middle-aged woman, conscious but pale. Laura was assigned to handle her intake forms while a resident examined the patient. But Laura's trained eyes saw what the resident missed. The woman's breathing was shallow, but not from panic. Her skin had a grayish tint that suggested internal bleeding. Her blood pressure was dropping, but slowly enough that the monitors hadn't triggered any alarms yet. Laura quietly started an IV line and began fluid resuscitation without being asked. When the resident noticed, he snapped, "I didn't authorize that treatment." "She's going into shock," Laura said calmly. "Her mean arterial pressure is dropping." The resident checked the monitors. Everything looked normal to him. He was about to argue when Laura's patient suddenly went into cardiac arrest. Laura was already moving. Her hands found the crash cart before anyone else even realized what was happening. She began chest compressions with perfect rhythm and depth while calling out medication orders that saved the woman's life. Dr. Whitmore appeared at her shoulder, watching in stunned silence as Laura managed the code blue with surgical precision. The second ambulance brought in a teenage boy with what appeared to be minor cuts and bruises. Everyone assumed he was stable. Laura took one look at his eyes and knew better. She quietly performed a pupil response test. Unequal dilation, possible traumatic brain injury. Without waiting for permission, she elevated his head 30 degrees and started documenting neurological signs every 15 minutes. When the boy began vomiting 2 hours later, Laura had already prepared the anti-nausea medication and positioned him to prevent aspiration. The third patient was an elderly man who seemed alert and responsive. Laura noticed his left hand trembling in a way that had nothing to do with fear. She quietly checked his medical bracelet. Diabetic. His blood sugar was crashing, but he was still conscious enough to refuse treatment. Laura knelt beside his stretcher and spoke in a voice that somehow cut through his confusion. "Sir, I need you to drink this orange juice for me. Just a small sip." Something in her tone made him comply. 20 minutes later, his blood sugar stabilized, and he thanked her for the best orange juice he'd ever tasted. Patient after patient came through Station 4. Each time, Laura would quietly identify problems that others missed in the chaos. A pneumothorax that she caught by listening to breath sounds, a severed artery that she temporarily compressed until surgery was available, a spinal injury that she immobilized before permanent damage could occur. Dr. Whitmore found himself drawn to Station 4 repeatedly. He watched Laura work with a combination of fascination and confusion. Her hands moved with the confidence of someone who had done this 1,000 times before. Her voice remained steady even when everything around her was falling apart. During a brief lull, he approached her directly. "Where did you train before coming here?" Laura paused in her documentation. For just a moment, something flickered across her face. Not fear, but the careful consideration of someone choosing which truth to share. "Different places," she said finally. "You learn to adapt." It wasn't really an answer, but there was something in her tone that discouraged further questions. The final patient of the night was a young mother who had shielded her daughter during the crash. She had multiple lacerations and what appeared to be a broken arm. Standard trauma protocol called for X-rays and pain management. Laura saw the way the woman's breathing changed when she tried to move. She quietly palpated the patient's abdomen and felt something that made her blood run cold. Internal bleeding, possibly from a ruptured spleen. This time, Laura didn't wait for permission or approval. She looked directly at Dr. Whitmore and said, "This patient needs emergency surgery, now." He started to question her assessment, but something in Laura's eyes stopped him. Without another word, he ordered the patient prepped for immediate surgical intervention. 90 minutes later, the surgeon confirmed that Laura had been exactly right. The woman's spleen had been lacerated in 2 places. Without immediate intervention, she would have bled to death internally within hours. As the last patient was wheeled to recovery, Dr. Whitmore stood in the middle of the now quiet emergency room. He looked around at his staff, exhausted but proud of their work. Then his eyes found Laura, who was quietly cleaning and restocking Station 4 for the next shift. She moved with the methodical precision of someone who had learned that preparation could mean the difference between life and death. Every supply was checked twice. Every piece of equipment was tested and positioned perfectly. Dr. Whitmore approached her one more time. "That was exceptional work tonight." Laura looked up from her restocking. "Just doing my job." "No," he said quietly. "That wasn't just nursing, that was battlefield medicine." Laura's hands stopped moving. For the first time all evening, she looked directly into his eyes. And Dr. Whitmore saw something there that made him take a step back. Those weren't the eyes of a new graduate nurse. Those were the eyes of someone who had seen things that most people couldn't imagine. As Laura gathered her belongings from her locker, Dr. Whitmore noticed something he had missed before. On her wrist was a thin silver bracelet, and when she reached for her coat, her sleeve pulled back just enough to reveal a small tattoo on her forearm. Not a decorative design, but numbers and letters that looked like military coordinates. The truth about Laura Keating began to unravel the next morning when Dr. Whitmore couldn't stop thinking about what he had witnessed. Her movements had been too precise, too automatic, her knowledge too deep for someone with her supposed background. He made a phone call to Dr. Marcus Chen, a military surgeon he had served with during his own brief stint in the Army Reserve. They had remained friends over the years, and Chen now worked at Walter Reed Medical Center. "Marcus, I need you to help me figure something out. I have a nurse here who, well, she handled trauma cases last night like someone who had been doing battlefield medicine for years." "What's her name?" "Laura Keating. Claims to be a recent nursing school graduate, but I'm starting to think there's more to her story." There was a long pause on the other end of the line. "David," Dr. Chen said slowly, "are you telling me that senior combat medic Laura Keating is working as a civilian nurse at your hospital?" Dr. Whitmore felt his stomach drop. Senior combat medic? Laura Keating was a legend in military medical circles. She served 3 tours in Iraq and Afghanistan. Her final deployment was Mosul in 2017. David, this woman kept 6 critically wounded soldiers alive for over 4 hours during an ambush, working alone with minimal supplies while under enemy fire. The phone felt heavy in Dr. Whitmore's hand. She never mentioned any military service. She wouldn't. Laura was involved in a classified operation that went sideways. When she came home, she was dealing with some serious trauma. Last I heard, she had disappeared from the military medical community entirely. Most of us assumed she had left medicine altogether. Dr. Chen continued, "The skills you saw last night? Laura learned those in places where making the wrong decision meant watching people die. She can perform emergency surgery with a combat knife and a flashlight. She once kept a soldier alive for 6 hours after an IED explosion took off half his chest cavity." Dr. Whitmore sat down heavily. Why would someone with those qualifications take an entry-level nursing job? Because she's starting over. Some people come back from war and want to forget everything they learned over there. But Laura, the skills are too much a part of who she is. She can't turn them off, even if she wanted to. After hanging up, Dr. Whitmore sat in his office staring at Laura's personnel file. The resume listed a nursing degree from a community college, basic certifications, and no prior medical experience. It was entirely fabricated, but so skillfully done that it had passed all their background checks. He found Laura in the cafeteria during her lunch break, sitting alone as always, reading a medical journal while eating a sandwich. "Mind if I join you?" She looked up, and he saw wariness flash across her features. She nodded to the empty chair. "I had an interesting conversation with Dr. Marcus Chen this morning." Laura's sandwich stopped halfway to her mouth. She set it down carefully and looked directly at him. For the first time since he had known her, she didn't try to look away. "What did he tell you?" "That senior combat medic Laura Keating was one of the finest trauma specialists the military has ever produced. That she saved more lives in impossible situations than anyone had a right to expect." Laura was quiet for a long moment. When she spoke, her voice was steady but tired. "That person doesn't exist anymore." "The hell she doesn't. I watched her save 6 lives last night using skills that civilians aren't supposed to have." Laura sighed and pushed her lunch away. "Dr. Whitmore, I applied for a nursing position because I wanted to start over. Clean slate. No expectations based on what I used to be able to do." "Why?" "Because over there, every decision I made was life or death. Every soldier I couldn't save haunted me for months. When I came back, I couldn't handle the pressure anymore. I just wanted to help people in a quiet way, without the weight of the world on my shoulders." Dr. Whitmore leaned forward. "But you can't turn it off, can you? The training, the instincts." "No," she admitted. "I see things that other people miss. My hands know what to do before my brain catches up. Last night when those patients started coming in, it was like being back in the field hospital in Mosul." "Tell me about Mosul." Laura was quiet for so long that Dr. Whitmore thought she wouldn't answer. When she finally spoke, her voice was barely above a whisper. "June 15th, 2017. Our convoy got hit by an IED, then small arms fire. 6 wounded, 2 critical. Our medic was killed in the initial blast. The extraction helicopter was 40 minutes out, but we had soldiers who wouldn't last 10 minutes without immediate surgical intervention." She paused, staring at something only she could see. "I performed field surgery for 4 hours straight while insurgents were shooting at us. No anesthesia, no proper surgical tools, just combat knives, field dressings, and IV tubes. I kept those 6 men alive by sheer force of will and whatever medical knowledge I could pull from memory under fire. Jesus Christ. All 6 of them made it home. But I couldn't handle being responsible for life and death decisions anymore. Not like that. So I left the military, went to nursing school under a different name, and tried to find a way to help people without carrying the weight of command." Dr. Whitmore sat back in his chair. Everything made sense now. The quiet confidence, the ability to see problems before they became critical, the way she could remain calm when everyone else was panicking. "Laura, what you did last night wasn't just good nursing, it was exceptional trauma medicine. You identified complications that residents with 3 years of training missed entirely." "I know." "Then why are you hiding? Why pretend to be something less than what you are?" Laura looked directly at him, and he saw pain in her eyes that he hadn't noticed before. "Because being exceptional means people expect you to save everyone. And when you can't, when you lose someone because you made the wrong call or moved too slowly, it destroys you from the inside out." Dr. Whitmore nodded slowly. He was beginning to understand. "But you're still doing it, still saving lives. I can't help it. When I see someone who needs help, I can't just walk away. The training is too deep. The instincts are too strong. Then maybe it's time to stop hiding from who you really are." Laura picked up her medical journal and closed it carefully. "Dr. Whitmore, I appreciate what you're trying to do, but I'm not ready to be senior combat medic Keating again. I may never be ready." She stood to leave, then paused. "But I promise you this, as long as I'm working in your ER, no one will die because I was too afraid to act. CTA, type I owe a debt. If you've ever been saved by someone who never asked for credit." Laura never spoke about her conversation with Dr. Whitmore, and he respected her privacy. She continued working as a regular ER nurse, taking the same shifts, handling the same basic responsibilities. But something had shifted in the emergency room dynamic. Word of her performance during the bus crash had spread quietly through the hospital staff, not as gossip, but as professional respect. Nurses began asking her subtle questions about patient assessment techniques. Residents started paying attention when she made suggestions. Laura didn't seek out these interactions, but she didn't avoid them either. A young nurse named Jessica approached her during a quiet Tuesday night shift. "Laura, can I ask you something? Last week you looked at Mrs. Patterson and immediately knew she was having a heart attack, even though her EKG looked normal. How did you know?" Laura considered the question carefully. "Women present differently than men during cardiac events." Mrs. Patterson was sweating, but not from exertion. Her jaw was tense, and she kept touching her left shoulder. The signs were there if you knew how to look. "Could you teach me what to look for?" For the first time in months, Laura smiled. "Sure, but it's not about memorizing symptoms. It's about learning to see the whole person, not just the obvious problem." Over the following weeks, these informal teaching moments became more frequent. Laura would quietly explain how to read subtle changes in breathing patterns, skin color, and posture that indicated hidden medical problems. She never called them training sessions. She just answered questions when asked and shared observations when appropriate. One evening, Jessica successfully identified a stroke in an elderly patient who had come in complaining only of dizziness. The quick intervention saved the woman from permanent brain damage. Jessica found Laura in the supply room afterward, tears in her eyes. "I never would have caught that without what you taught me about facial asymmetry." Laura nodded approvingly. "You trusted your instincts. That's the most important thing." "Where did you learn all this?" Laura was quiet for a moment. Different places, different situations where getting it wrong wasn't an option. The teaching continued, but always quietly. Laura never drew attention to herself or claimed credit for her students' successes. She simply shared knowledge when asked and trusted others to put it to good use. Dr. Whitmore watched this transformation with interest. Laura was creating a ripple effect throughout the emergency department. Nurses were becoming more observant, more confident in their assessments. The overall quality of patient care was improving measurably. During their monthly staff meeting, he mentioned the improvement in diagnostic accuracy among the nursing staff. "I don't know what's causing it, but our nurses are catching critical problems earlier than ever before. Patient outcomes are improving across the board." One of the senior nurses spoke up. "Laura's been sharing some assessment techniques with us. Informal stuff, but really helpful." Dr. Whitmore nodded knowingly, but didn't elaborate. After the meeting, he found a moment to speak with Laura privately. "You're teaching them. They're asking questions. I'm just answering them. You're making them better nurses, better medical professionals." Laura shrugged. "Everyone deserves to have the knowledge they need to help people effectively." "Is this what you want? Teaching instead of practicing advanced trauma medicine?" Laura considered the question seriously. "Maybe. It's satisfying to share what I know without having to carry the responsibility for everything that happens." She paused, then added, "Besides, if I can teach 5 nurses to catch problems earlier, that's potentially more lives saved than anything I could do working alone." Dr. Whitmore smiled. "You're still saving lives, Laura, just in a different way." "Yeah," she said quietly. "Maybe that's enough." 3 months later, someone had written next to Laura's name on the duty roster, "Cool head, warm heart." Laura never found out who wrote it, but she never asked for it to be erased. CTA, type, "I will live with kindness if you believe that quiet service sometimes saves more lives than loud heroics." Laura Keating's story teaches us something profound about the nature of heroism and service. She represents thousands of military veterans who return from combat zones carrying skills and experiences that civilian society doesn't always recognize or value. Many of these men and women choose to serve quietly in new roles, using their hard-earned expertise to help others without seeking recognition or acclaim. The 3 hours Laura spent during that bus crash didn't just save multiple lives. They revealed the hidden depth of talent and dedication that exists all around us in unexpected places. Every day, in hospitals, schools, fire departments, and countless other workplaces, there are people whose background and capabilities far exceed what their job descriptions might suggest. They're former military medics working as paramedics, retired teachers volunteering at literacy centers, ex-police officers coaching youth sports teams. These individuals have made conscious decisions to step back from high-pressure, high-profile roles in favor of quieter service. Not because they lack ambition, but because they've learned that true fulfillment comes from helping others, not from personal recognition. Laura's approach to her colleagues is particularly instructive. She didn't demand respect or try to prove her superiority. Instead, she quietly demonstrated competence and shared knowledge when asked. She understood that lasting change comes through example and education, not through confrontation or ego. The transformation of the emergency room nursing staff shows how one person's expertise can multiply exponentially when shared generously. By teaching others to recognize critical signs and trust their instincts, Laura created a legacy that extended far beyond her individual capabilities. Perhaps most importantly, Laura's story reminds us not to make quick judgments about people based on limited information. The quiet person in the corner might be the most qualified person in the room. The new employee who seems hesitant might actually be exercising the kind of careful judgment that comes from years of high-stakes experience. In our fast-paced, attention-seeking culture, we often overlook the steady, dependable people who do their jobs excellently without fanfare. We celebrate the loudest voices while missing the most experienced hands. Laura chose civilian nursing not because she had given up on excellence, but because she had learned that excellence takes many forms. Sometimes the most heroic thing you can do is step back from the spotlight and focus on doing good work for its own sake. Her silver bracelet with coordinates from Mosul will always remind her of where she learned that every life matters and every decision has consequences. But her choice to start over as a civilian nurse shows that growth sometimes means choosing a different kind of courage. The next time you encounter someone who seems understated or quiet in their approach to work, remember Laura. They might just be the person you'd want standing beside you when everything falls apart.
If you believe in stories that touch the heart like this one, leave a comment. And don't forget to subscribe to The Veteran Story. We tell the stories that shouldn't be forgotten. Real people are creating and telling stories, not mass-produced AI.